I'm Fiona Burnett, the Customer Training Team Leader here at Magenta's Practice Management, and today I'm presenting the latest releases in Gentu, including features in the tasks area, improvements to the clinical record, SMS scheduling, and some letter template improvements. We will also get some further insights and updates on e-requests and e-bookings. You can use the Q&A box at the bottom of your screen to send through your questions, and we'll answer as many as we can during our popular live Q&A segment. This session will be recorded, and a copy of the recording will be sent to all registered participants tomorrow. Firstly, we'll take a look at tasks in Gentu, as this area has improved features for visibility as well as functionality. Tasks can now be sent to individual users as public or private tasks. Ticking this mark as private checkbox indicates that the assigned recipient will receive the task notification, and the task will only be visible to the sender and their recipients. This allows the appropriate handling of confidential or sensitive tasks within the practice. When sending a public task, meaning you leave this mark as private box unticked, the assigned recipients will be notified as per usual. The difference being that now other users at the practice can also view these public tasks. This ensures tasks are not missed if users are off, sick, or away. Change sees the ability to link a patient in any new task window that you open, ensuring a streamlined method for sending tasks in Gentu, no matter what area you are in. The tasks reviewing area has also had a facelift to allow for smart and easy filtering of tasks, so you can find the tasks you need when you need them. Firstly, you can view in this area, you've got filter options for all of the public tasks that are available. So you can filter these to assigned to, created by, and by patient. You can also filter your own tasks by the status type and task type. As well as that, you can display the results by choosing those tasks that are in progress or completed, or have both ticked for an all tasks view. You can also arrange the list by using a number of different sorting options, by sorting urgent first, sort by due soonest, or sort by due latest. You will also see changes within a patient's clinical history area, as there is a new icon available for dedicated diagnostic requests. In this section, you can now easily view and manage patient diagnostic requests. The status of requests, either outstanding or completed, will appear against the test based on the corresponding result being available in Gentu. You could also manually mark the requests as received by clicking the dedicated checkbox. You can open the test request to easily access the reprint function, or copy the request by clicking the copy icon to embed the previously ordered tests into a new request form. We believe these updates will help you to improve your clinical workflows and enhance your dedicated patient care. Another new feature within the clinical history workspace is multi-select. We listened to your feedback and have made some important changes to this area. You can now select multiple clinical tiles in the clinical history area. In this example, the practitioner has chosen the view of consultation notes as well as requests. All other contact areas are hidden from this view, ensuring you can focus directly on what you wish to review for the patient in front of you. It's also easy to change between the tiles if you're looking for something else entirely. And importantly, multi-select is enabled per user, ensuring that each practitioner has the experience that they desire. SMS space now. Previously, your appointment reminders and booking confirmations were in separate tabs in Gentu. We have now simplified this workflow. So to get started, firstly, go to Settings and click on the SMS Templates and Schedules area. Within this section, you will see that appointment reminders and confirmations are managed from the one streamlined page. You can add an SMS schedule by clicking the button on the right. At the moment, any schedules that are set will apply to all appointments booked for all providers at the practice. Enhancement to these features to allow even more customization is currently on the roadmap. Within the configuration page, this will allow you to set schedules for both appointment confirmations and appointment reminders. The SMS messages can be copied from your existing practice templates, meaning less data entry, or you could create a specific message to suit your needs. We've also introduced a scheduling cadence, meaning you choose when the SMS messages are to be sent, and it can be tailored to either after an appointment creation or before the appointment date. So how would schedules work at your practice? In this example, we have a 3-cycle appointment schedule that has been created. Firstly, the initial appointment confirmation message is set to be sent 15 minutes after the appointment is made in Gentu. This gives your patients an early indication of when their appointment is, and they can have that information to refer back to. Next, 7 days prior to the appointment, an initial appointment reminder is sent. Then, 3 days before the appointment date, a final reminder of the appointment goes to the patient. The schedules you've created can also be edited by clicking into each schedule, or you can use the toggle to mark them as inactive if no longer needs to be in use. Within the correspondence area, you can now directly attach additional clinical documents into your outgoing letters. Within this area, you can attach any files or previously sent letters to your outgoing correspondence. The way this works is that all attachments will appear on their own page, and it will also be included when the letter is sent electronically. The updated user interface within our letters area allows for a simpler selection of the sender, the type of letter, whether it's to a doctor or a patient, who the addressee is, and any CCs to be included. It's also possible to create a full-page letterhead that will sit in the background of the letter, allowing for the use of your own branded stationery. These changes to the user interface of the letter writer aims to simplify your letter creating and letter writing experience. We are really excited to let all our Gentu mobile users know the ability to create consult notes within the app is now available. Consultation notes can be created in the app from either the appointment book or the patient list. In the consult area, your Gentu text shortcuts are available to be used by clicking this icon. Have an active voice subscription, you can go ahead and click the microphone icon to dictate the consultation information. As you can see, our teams have been working hard to identify areas of Gentu to improve your clinical workflows and improve your patient care. quick win coming soon is the ability to select a patient's pronoun in the patient details screen, and this is placed just under the date of birth field. This addition allows you to respect your patient's individual identity and helps patients feel more comfortable when dealing with your practice. Keep an eye out for in-product messaging with more information on this widely requested Voice of the Customer feature next week. I will now hand over to Neve, our Director of Product Strategy and Design.
Thank you, Fiona. Hi, everyone. My name is Neve, and as Fiona mentioned, I'm the Director of Product Strategy and Design within the Practice Management division. So that means I sit across Genie and Gentu, but also all of the other products new products that we have currently in development across our group. And I'm really excited to talk to you about two products in particular today. First of all, e-booking. So over the past 18 months, we have been collaborating with Healthscope to develop a digital procedure booking workflow that is really tightly integrated into both Genie and Gentu. Do you want to click down a slide, Fiona, if you can? And e-bookings is really designed to save you time when booking theatre. Right now, it is available at Healthscope and ACHA hospitals. And this new digital theatre booking workflow is what we're calling e-bookings. It's completely free for all Genie and Gentu practices who book theatres at Healthscope and ACHA hospitals. And it's available right now across the majority of Healthscope hospitals. And I'll touch on that a bit more in a bit more detail later. If you click to the next slide, Fee. E-bookings allows us to take the patient and the procedure information that you've already entered into Gentu and then shares this across to the hospital bookings team electronically. It's removed the need for sending of draft theatre lists. It allows you to upload consent forms as part of the process, which users are telling us massively reduces the incidences of patient paperwork that's being lost. We've been running a pilot with Healthscope since about May. And we started the national rollout in September this year. So during this time, a number of Genie and Gentu practices participated, and we've had over 3,000 bookings sent across. And some of the key benefits practices are reporting, you can see here. And so that includes significantly improved practice efficiency due to the reduced admin time for managing bookings. There is no more draft theatre lists. Lost forms, as I said, are avoided, with the booking and the consent being able to be supplied on the day of the consult. Booking status can also be tracked in real time. So once you send the booking across to Healthscope, you can actually see that that booking has been accepted. And if there are any feedback or actions that need to be taken, you'll see that within your Gentu interface. And patients are telling us that this has had a really big impact on their experiences as well. Because the booking goes to the hospital on the day or soon after the consultation with the doctor, patients are actually receiving confirmation from the hospital that their booking has been received by the hospital. So this means that they're not left wondering, what's happening with their procedure during this period of time. Practices are saying to us that they're getting much less, far reduced calls from patients asking, is their procedure still going ahead, and things like that. It also means that there's an opportunity for things like health fund eligibility checking to be surfaced up early, or any other needs like ICU beds. And what we're seeing is that this is reducing the number of last minute cancellations that are actually occurring across the hospitals that have been participating in our pilot. So look, we are well underway with our rollout, and actually our last group of Healthscope hospitals went live last week. As you can see here, there's a number of hospitals across Queensland, the Northern Territory, South Australia, WA, the ACT, New South Wales, Tas, and Victoria. There is one hospital that I have listed on here, which is Northern Beaches Hospital. We aren't live there just yet, but we will be going live there very soon in the coming weeks, and certainly this side of Christmas. So many of you might be thinking, I'm keen to get started. And so if you do want to get started, it's really straightforward within Gentu. We have actually switched on e-bookings in the back end for all Gentu practices that we could identify were operating at HealthScope hospitals, HealthScope or ACHA hospitals. If for some reason you're not seeing the e-bookings button in a patient's clinical area in the procedure window, please reach out and we can just check that it has been switched on for your practice. Many of you should already have received an email from us to let you know that e-bookings is available. And very soon, either today and certainly this week, we will be launching a product tour within Gentu, which actually steps you through and helps you become familiar with the e-booking workflow. We're also running an e-bookings lunch and learn on December 14th. So this will be open to all Genie and Gentu practices. And what we'll do at that lunch and learn is we'll actually step through the workflow in quite a bit of detail. So we'll step through exactly what you need to do to create bookings and how you can see the statuses of the bookings that you've already created. The invitation for that has gone out today. But again, if you haven't received that, please reach out and we'll make sure to send a copy of that invite your way. If you click down, thank you, Fiona. Now on to another exciting product launch for Gentu, and that is e-requests. So e-requests is a digital pathology requesting workflow. If you click one more, Fiona. It's a digital pathology requesting workflow that allows you to create, send, and view digital pathology requests directly within Gentu. And again, this is at no additional cost to Gentu practices. So when creating a request in Gentu, the request is actually sent directly to the lab, and an SMS is sent to the patient with a barcode on it that they can then present when they go into the collection center. We've heard many stories from specialist practices that patients often lose their request forms. So this means practices have to regenerate the request forms and then often print, scan, and email request forms out to patients because they're not in the room. So e-request cuts out all of that admin overhead of creating and sending requests for patients, and also helps in the situations where you're doing requests for prior to surgery or prior to consultations when the patient isn't with you. For e-requests, we've partnered initially with Sonic Healthcare. Oh, sorry, if you just pop back up, Fiona, I'll talk this one in a bit more detail. And again, we've been piloting e-requests at a number of practices since September. Excitingly, we launched this week to all Genie and Gentu practices in Queensland, the Northern Territory, and New South Wales. And some of the benefits that practices are saying they're experiencing is there's greater visibility of requests that are sent to the lab, which really increases practice efficiency because it allows you to understand if you need to follow up with a patient. You can see straight away if they've actually presented to have their test completed. And so then you can either follow up with the patient or you can follow up with the lab more directly if you haven't received that result. Because an SMS is sent straight to the patient, as I said, there's much less overhead associated with the generating of requests for patients that are not present in the room. And the last one, but the most important, is that there really is improved patient outcomes from pathology e-requesting. There is far greater accuracy of the tests and the clinical information that is captured through an e-request in comparison to a paper request, because we often see transcription errors happening with those paper-based pathology requests. So if you click to the next slide, Fiona, as I mentioned, we launched this week with Sullivan and Nicolaides. That was on Monday. They are the pathology brand that is located in Queensland, Northern New South Wales, and across the Northern Territory. So if you're a Gentu practice in these areas, when you click on the add button, either from a patient appointment or from the patient's clinical area, you should now have two options, one which is request and one which is an e-request. And you can get started sending e-requests straight away. As we head into the new calendar year, we will be working with Sonic Healthcare on a national rollout that will start with Douglas Hanley Moyer, probably around February time. But then we will be rolling out to all of the pathology brands that you see on the right-hand side of the screen as we work our way through the 2024, but certainly Q3 or the first quarter of that calendar year. If we click down to one more slide, I kind of spoke through it already, but for Gentu, it's already switched on for those practices that are located in this area. Again, if for some reason your practice preferences isn't set up correctly and we've missed you and you're not seeing that e-request function, please reach out to us. Otherwise, you can jump onto our knowledge base. There's a number of knowledge base articles there on how to configure. So that's just making sure that you have your provider preferences set up correctly, and then you can start creating e-requests straight away for any number of the practitioners in your practice. So thank you. We're really excited to launch both of these products. It's things that our team have been working on for over 12 months now, and we really look forward to hearing your feedback on how they benefit your practice over the coming months.